The operating room is not an environment that most people get an opportunity to even step foot in during nursing school. So in talking about sharp safety in the OR, I want to make sure that you have the training I helped create is a scrub boot camp. So the setting is particular to the operating room, and part of what we do in the operating room is perform surgery, of course. Surgery has to maintain sterility, so it keeps everything as clean as possible, cuts down on any infection or risk of infection, so we can provide safe care to our patients. But nurses aren't given that opportunity to learn those techniques, those skills in nursing school. Sterile technique, sterile hand washing, we're not doing this in nursing school. This is something we're all kind of learning on the job, or we take some dedicated time to train and make sure you do it properly.
That first month in simulation was a game changer for me because it really taught you about sterility. Sterility is very important because it's ensuring patient safety. In maintaining sterility, you are ensuring that the patient doesn't suffer from an infection because we are opening them up during the procedure, and you want to make sure that they aren't going home with something that they acquired here in the hospital.
This is unique for the VA, being that we have this simulation lab. We can do foundational skills in a setting that's relatively safe. The opportunity for you to make mistakes so you can do them here rather than bring it to the table and have a patient in front of you. This environment allows you to learn everything that we could possibly teach you as basic foundational skills in the operating room, how to put gloves on correctly, how to count instruments, how to identify instrumentation, then bring that with a little bit of confidence into the operating room.
I'm gonna need to go in here. Yep, perfect.
I think with every job you have a little bit of pressure on you, especially in the operating room. There's a lot of pressure. You have somebody's life on the line. And so I felt more confident in my abilities to perform the tasks needed because of the training. However, I'm always going to be asking questions, and nursing is a constant education.